Please welcome for those who just joined us. And we wish we are very glad to have you on board on this hackathon. So my name is Benjamin Musole. I'm one of the volunteers for EMR4All and also part of member of OpenMRS community. So you all received the invitation to join this hackathon, and some of you may be asking what this is about and how, what is the purpose and objective of this hackathon. So hackathon, we plan for 5 days. So let's say from today up to Friday, it's almost 4 days, but we had a 1 day within. So the plan is we need to come out with a solution for different track. So this is a joint venture or a joint hackathon together with OpenMRS community. EMR4All is part of the OpenMRS community and is supporting this event. But all the activity, all the leadership, and all falls under the OpenMRS community. So the aim of this is to come up with the solution and from different tracks that enable to push forward the agenda of offline capable OpenMRS or EMR. Prototype for enabling remote health facilities to have access to electronic medical records for last mile, for places where there is issue for disconnectivity. Solution we tested and it is workable. So this product has been built with volunteers from OpenMRS community. So we want to expand this expertise. We want to share this experience for enabling many of you guys to be able to bring your skills in a free major track. The first one is related to development track. So we have within the software development track a part that starts with OpenMRS ticket. So as we are all part of the community, there are some tickets that are pending, and we want to make sure that within this volunteer platform, we are able to address some of tickets that is on the community. And we have also our newbies. Newbies are people who have joined, who want to discover, who came from different areas, and they want to join effort to contribute to this to the OpenMRS community. So we have a track for guiding them throughout how to code, what are the different environment to work through if they want to contribute to the OpenMRS solution. We have another track that composed with implementers, which is also based on also for implementation of OpenMRS, and also advocacy track. So all the detail about signing, about the hackathon program has been shared with you. And I invite you to revisit those details to have more information about it. So coming back to where we are and how we move forward during this 3 day. First of all, I have to welcome you for all that you have joined, all that you made available for attending this session. So today we start with a kickoff with different guest speakers who will drive us through the different experience related to the environment. And we start first of all with our community director of product, who we invite to give us an overview of what is OpenMRS about, for those who are new, for those who are discovering, for those who are asking questions, how do you join the program? So, and what is OpenMRS? So that is one of our speaker. So I hand over to dear Grace to lead us through that part. Thank you.
Hello, everyone. Wow, what an honor to be the first guest speaker in this event. This is a really exciting event because, as far as I know, this is the first time we've had an event like this where we've had such a wonderful partner come together with the OpenMRS community and say, hey, we'd really like to connect and welcome volunteers in a way like this. So amazing to have you all here. So I'm going to cover just a few things over the next 10 minutes. Let me share my screen here. There we go. And we'll kick this off together. All right, please let me know if at any point you can't share my screen, and apologies, sometimes my internet drops for a few seconds. I'll come back right after. Don't worry, I'm not gone for good. So my name is Grace Potma. I'm Director of Product supporting the OpenMRS community. I work for OpenMRS Inc., which is kind of like a foundation. It's a charity that supports the OpenMRS community. So my job is to make sure that we're listening to what our community members need in terms of the product. And then my amazing colleague, Beryl, she is our head of community. So together we work on product and community to support what our community is asking for, either from the product or from the way that the community works. So I'm going to dive a bit more into the product side, and then Beryl is our community expert. So what is OpenMRS? In case you don't already know, there's three main things to know, and that's that OpenMRS is an open source medical record system, also known as an EMR or electronic medical record system. It's specifically for low resource settings. That can be anywhere in the world. Typically, it's lower middle income country settings, but sometimes it's in high income countries too, where we have things like First Nations reserves where folks have very, very few resources. It could be anywhere where you have a resource constraint of some kind. And then the key thing that makes us different from other medical record systems in the world is that we're maintained by you, by our global community. We're not one big core team. We don't even have a headquarter office. We really work as a global remote community to get things done. And once a year, as you see in this photo, we meet up in person to connect at a conference. So our mission, we actually have a mission as a charity. So our legal mission is to improve healthcare delivery. We like to say very often, we say better healthcare information means better care. Years ago, I used to be a specialized critical care nurse. My specialty was in caring for people when they came into the accident and emergency department. And we saw this all the time, that if we didn't have the right information, we couldn't give the right care. And medical records make a big difference in that. So we want to improve healthcare in resource-constrained environments, and we do that in two ways: by coordinating the global community and implementing this open source medical record system platform. And speaking of that platform, speaking of the product, one of the ways we do this is we add more and new and better features all the time because of you, because of our global community. Things are being updated frequently. So picture, there's different examples of features that have been contributed by different teams or squads or individual contributors to the community that are now part of the medical record system. But let's talk more about the what, and then I'll talk more later about the how we accomplish this together. So in terms of the what, the product, let's talk a bit about the medical record system. This is what the medical record looks like. In fact, we can log into the demo later if we have time, and you can see it for yourself. But basically, you have a patient chart, and she or he has a whole bunch of information about them that's always kind of true. This is what we call their long-term or longitudinal record. Then sometimes programs will ask, they'll say, hey, you know what, for our diabetes specialists, they really only want to know A, B, C, D. So you can create program or site-specific views when you have a team that says, we only want to know information about Agnes's HIV history or her diabetes history. Then you can kind of filter that information with that. But what's really cool is what's going on behind the scenes here in the OpenMRS product. So in this screenshot of Agnes's record, how is this being built? Let's look under the hood here. So under the hood, we've all kind of agreed on this skeleton of how to build the medical record system. These are the different key kind of areas that things can plug into, like the navigation on the left that you saw over here, like the body of the chart, and then a workspace as well, where you can do things like order drugs, order labs, record notes, all while still having the patient chart open so you can cross-reference while you're working. But what's cool about this is that inside of this skeleton, we need to plug in some organs. We need to put some things in our skeleton. So how do we do that? We add what we call widgets or applications. These are called micro front-end applications. If you're technical, this is like microservices for the front end. And each of these little applications plugs in on their own. What this means is that, let's say you start working for an organization that has a contract to roll out the software in a new place. And that new place says to you, we don't like the immunization app that comes from the community. We want to build our own. You'd say, okay, don't recommend that, but no problem. We can add our own and it'll just plug in like this. Or if you see that someone else has done something that you really like, you can take that and put it in as well. And that's the beauty of the open source community. So that was a bit of the what we work on, the product and how it looks and feels. And some of those screenshots are old, to be honest with you. The product's looking even more exciting every day. So how do we do this as a community? We say all the time that we are OpenMRS as a global community. And this is another photo of one of our annual conferences. I think this one was in Kenya or Uganda. And you can just see some of the amazing faces of the people that literally make this happen. So there's a few vital signs that we tell people anytime you're looking at an open source project, either because you want to use it or get involved. There are a few key signs you can look at to see if the project is healthy. So here's some of our key signs. We have an active forum. You might have heard about the talk forum. And don't worry, I'm going to share a link to this presentation in the chat so that all these links are easy for you to find. Yeah, we have an active forum where anyone in the world can ask their questions. We have an active chat as well on Slack. We also have a lot of code momentum. If you go into our GitHub, you'll see that there's a lot happening day to day. In some open source projects, you'll see that it looks like the patient is dead because the lines have stopped moving. So this is a good sign. One thing I really strongly recommend that you take down is this short link, om.rs/cal, because this will take you to the community calendar. And it will show you all of the events, including this one, that are happening on a given day. And you can change it to your time zone. So for example, for me, I'm in Canada and it's adjusted it to my time zone. You can see just tomorrow, we have a bunch of events going on. Wednesdays and Thursdays are also busy with community events. And you can see that here too. Okay, I'm not sure how I'm doing for time. Please stop me if I need to stop.
No, keep on. It's all right. Keep on. Yeah. Yeah, sure.
Lovely. So I'm going to show you. Oh, and then one more thing. Benjamin mentioned our issue tracker. We use a product called Jira to track our issues. And you can see that we really try to keep issues and tickets moving forward with commentary and feedback. I'm going to share a story with you. Here's an example of how we try to get features done by teams, or what we call squads. So for example, a community member will share an idea. In this case, this guy, Michael, from a community organization, he shared, hey, we want to work on a print feature. So then he actually started writing the tickets. Here you can see he wrote the tickets in our issue tracker. He's got an epic, and then he's got the issues here that need to be done. Like you need to do 1, 2, 3. Then, oops, sorry, I clicked the link. Then we start writing code. It's really important to us not only to support you as a community, but to make sure that the code that we get from you is high quality. And the reason for that is that this code is actually going to be used to care for patients, even babies. So we want to make sure that the code is good. And that's why we do code reviews, and we'll give you different people around the world who have like high skill levels. They'll usually be in charge of doing code reviews. Not all of them are paid by us. Not at all. In fact, most aren't. They're from other organizations. And because we're a community, they're going in and giving feedback because that's just what we do together. So here's a peer review. Don't be surprised or offended if you get a lot of feedback. Some people get really overwhelmed, but it's just because we want to make sure that there's good quality. And then voila, after going through this project workflow, this feature did in fact get made. We now can print patient ID stickers from the newer application of OpenMRS. Story number 2 is not code-based. Here's an example of translations. So we're using different things to help with translation. If you're really passionate about translation, someone just posted on our forum, hey, I'm from Vietnam, I'd like to help. So we onboarded them. He went ahead and started adding the Vietnamese translations. And that was it. Like, that was really great. It was a really fast way for him to contribute. So the point is just like, whether it's code or translation or something completely different like advocacy, we really appreciate all of your involvement. We couldn't do this without you. A couple quick frequently asked questions before I wrap up and invite questions. Folks will often ask, hey, if OpenMRS is a global community, does that mean that you can see patient data? Like, is there a privacy problem here? No, we don't, as a global community, we don't offer like a hosting service. We encourage organizations to do that themselves. So only the organizations can see patient data. And this diagram, we try to explain it here. So at the health facility level, you can see that the health facility, like at a clinic or a hospital, they work with their vendor, the people who are bringing them the technology and the people who are on the phone giving help desk support, and with their government, whether that's regional or national. And then we are up here, the global community. Here you are, volunteer contributors. Whoops. You can see them here. So we collaborate globally at this level, but we're not seeing data at this level. We're not sharing patient data up here in the cloud. So security, is open source software more secure? Yeah, it really can be, especially if you have so many people checking the code for issues. And we've certainly seen some amazing like security researchers report issues that we've been able to fix that no one would have known about if we were closed and proprietary. How do we work with users? We get a lot of feedback is shared by users at sites. It's shared with implementers and the vendors who roll out the software for them. And then they share that feedback with us at the global community level. So we love hearing from people who are working on the ground with clinics and hospitals. It's really helpful to hear their feedback. And lastly, we often get asked, do we have a code of conduct? Yes, we absolutely do. Basically, be kind to others online, be reasonable, and those are the main foundationals. We really try to keep OpenMRS as a very friendly open source community, and that's really important to us. Lastly, we can have a quick look so you can see where to find some of this information. So here, if we were to go to the wiki, here's the OpenMRS wiki. It is a bit overwhelming the first time you look at it. So I really encourage people to look on the left side here, where there's kind of a directory. And you'll see we have a section specifically called Releases and Roadmap. If you go there, you'll see that there are different things you can look at. One is the product roadmap or recent releases, as well as other community projects and the squad dashboard. I'm going to show you 2 of these. For the product roadmap, you'll see that there are 4 main things we're trying to do in order to create better care through better information. We want the system to be really scalable. That means it's flexible for different diseases, which it is, and also scalable, like with cloud technology. So that's something we've been working on a lot. The example of getting it to run on a Raspberry Pi successfully in the field is a really good example of meeting this, because you're trying to scale to places where, you know, AWS isn't working so well. Readiness for eHealth leadership, we're really trying to address the needs of ministries. And we're trying to build together, as we've just talked about, and as we will be this week. And lastly, making it as flexible as possible for all kinds of patient care, whether that's things like immunization programs or diabetes care or inpatient care in a hospital. We're trying to meet all those needs. So to see the roadmap, we have a plugin that shows you what was recently finished, like the concept management course, and things that are going on right now. So for example, or things that are coming up next. So for example, right now we've got a squad working on an out-of-the-box total facility package that will include things like complicated stock management and billing, etc. And how we get most of this done is through squads. I really encourage people, if you're new to working in a technical team, I think you'd really enjoy our every Thursday. You can find the information at that calendar link. Every Thursday, we have a call called the Squad Calls. And this is where every group of people from different organizations, you can see these are all the different organizations that at any one time are working on features together. They'll come once a week and share updates on everything they're doing. So for example, we're improving the label printing right now. So we'll hear updates about that every week. And another example is we're working on better inpatient care features. And so you'll also hear examples about that every week through this squad dashboard. Those were my main points for today. And what I'll wrap up by saying is that truly, OpenMRS is all of us. It's not one group of people in some fancy headquarters in America. Nope, that doesn't exist. We're all remote. The small global support team is about 5 to 10 people, where we work with the charity to try to answer questions and support the community. But we definitely cannot build all of this on our own. Absolutely not. We need all of you, and we're really thrilled to be together with you here today. Thanks for listening, and open to questions both here or in the chat. That would be great. Perfect, thank you.
Yeah, I think we can go to the next speaker, and Grace can take questions in the chat. So Benjamin, I think we can go to Sam, since he's already here.
Yes, please. Yes, welcome, Sam. You are muted, Sam.
Oh my goodness. I was just giving thanks to everyone. Thank you all for joining, and thank you, Benjamin and team, for organizing this. I'm Sam Rosmer, and I'm from a company called Vecna, which is actually now being rebranded into Be Inc. But I'll spare you that detail. But yeah, many of you, or some of you, might know us as Vecna. Let me share my screen, and I'll run you through what we're building. It's a very good complement to the presentation that you just heard, and really excited to be here to present it. So let's see. Where's my window? Let's see. Oh goodness, it's gone now. But one second, if you just bear with me. Aha, here we are. So let's see if you can all see my screen. Yeah.
Yes, we can.
Great. So yeah, my name is Sam Rosemar. We're we at Vecna have built a technology called LightBox, and I'll run you through what it does. But essentially, LightBox is what we call the backbone to rural digital healthcare. It solves a hardware challenge that we see often in the space. I know previously you just heard that Raspberry Pi is now able to have open EMRs on it, OpenMRS, and that's really great news. We sort of fit in close to that as well in rural healthcare settings. Apologies. Some of this details many of you in the audience will know. So please excuse me for giving a background information that might be obvious to some of you, but I hope some people also are learning for the first time. And I was asked to give a broader presentation here. Most East Africans, where we primarily work, live in places where healthcare facilities are few. Most doctors and hospitals are in urban areas, and 76% of the communities that we usually work with are in rural areas. There is also a proliferation of healthcare management startups across the continent. And again, this is just a snapshot of Africa specifically. We'll go into East Africa, but this applies to other places in the world. I know a lot of you are building healthcare solutions and are definitely interested in backing the open source solutions out there as well. Those are really great solutions, but they can't exist on, let's say, a phone or a tablet by itself, right? We're really constrained with the hardware solutions that can bring them. So when you're in a urban setting where a lot of these healthcare systems are deployed, yes, sure, they can have full-scale servers, they can have IT professionals, et cetera. But as you go further and further from those urban cores, what we found, and I lived in Ethiopia for 12 years, and now sort of bounce back and forth between East Africa and the United States. What we find is that the further you go, the less likely you are to have those systems. IT professionals don't exist in primary clinics, et cetera. What you find is often what you see on the left, on the right, even in the sort of higher end places, you have a Dell desktop or not to single out Dell, but a desktop computer that focuses on bringing in those EMRs. The problem with that, of course, is the power can go out. They're not digitally native. And in our opinion, desktops, although really the most widely used hardware, is really not fit for purpose. And even though, it is, of course, a quality machine. So what do we have instead? We have what's called the LightBox. This is a digitally native 12-volt battery. It has, and I'll cover some of the more details in it. It links to solar, a car battery, an internal battery. It creates a web server locally, so it's a local area network that it creates. It can cover a multi-building treatment area, and as I mentioned, establishes a LAN for multi-user access. Connects to the internet via cell, Ethernet, Wi-Fi, and Skylink. So this again solves for historical barriers. So redundant, seamless power and connectivity. We have offline sync to cloud and online use. We have a pretty low cost at scale. This is less than a laptop, or a high-end laptop, I should say, priced comparatively to most laptops. Locally sourced and trained technical support, and a single box can serve many devices. So you could have 6, 7, 8 tablets, et cetera, to have the input. The EMR is stored on the server, our local server, and then, of course, transmits to cloud servers, et cetera. And then, of course, can also be linked into biometrics, which, of course, allows for a variety of different applications. So what we think is that the next generation of digital health tools will be made by the next generation of entrepreneurs. Many of them are probably here in the audience today. And so, we're enabling new and better tech solutions in patient management, in clinic and hospital management, telehealth. And so, we're built on the back of the open source, but then, of course, we can build skins and other things that are fit for purpose in the communities that we are in, whether that be national laws that require different data management, whether that be local language, et cetera. These are all sort of layers on top of the open source platforms. Just to give you a bit more of the bundle, as you can see, the bundle is really centered around our aluminum cased hardware, wired into solar, car battery, and a plug, and then point of service data collection devices, tablets and phones, et cetera. Then it links to a regional cloud service. It can be through Wi-Fi, through cellular primarily. So there's a SIM card natively installed inside of it. It links asynchronous through an async network. And so basically when the network is up, it sends packets of data. And when the network, if it's down, it can store it locally on the server. That, of course, links to the regional cloud service, creates a digital record, creates a marketplace, and a data portal and an early warning system for pharma, for African Union CDC, World Health Organization, ministries, DHIS2, etc. So we have a bit of a proven model. So we've rolled out over 40 East African countries so far, 27 sites, 50,000 patient interactions, and 100 staff trained. We're looking to scale in Ethiopia, Kenya, and Rwanda primarily. We have a memorandum of understanding signed with the Ethiopian government for about 3,000 units, and then are talking to other governments as well. It's spinning out of Vecna, a U.S. healthcare company. We specialize primarily in patient flow management. We've done 250 million check-ins primarily through our kiosk technology, served dozens of hospitals in the United States, and have been in business for the last 20 years. Why haven't other platforms worked? A lack of local support, a lack of interoperability, unresponsive system design, and decoupled hardware and software. So we're really trying to sort of find the way through the hardware. And of course, software solutions like the ones we're talking about today are integral to work hand in glove, as we say, and making sure that these solutions actually impact the people that they're designed to impact. We're developing partnerships in the following areas: governments, donors, private sector, software providers, etc. If there's a country that any of you work in that you would like to bring the solution to, we'd really be open to that conversation. We can provide the hardware and allow you to have your software solution. We're not trying to lead the software development in a variety of countries. We're really working through a partnership model. I can talk a little bit about the EMR impact benefits for patients. It was covered a little bit in the last one, the presentation, and I'm sure you'll learn more about it today, and it's probably what brought you here. But just a little research that we've found is that if we launch 24 digital tools, and this is a McKinsey study, healthcare expenditure efficiency gains could be between 4 and 15% in Kenya, Nigeria, and South Africa. Paperless data alone could provide $700 million of savings and gains in Kenya, 900 million in Nigeria, 3.3 billion in South Africa. These are huge markets and opportunities for digital health solutions. And EMR has been proven at impact at systems, clinical, and patient level. Whether talking about Uganda and the implementation of EMRs in rural healthcare facilities led to a 45% increase in patients seen per physician per hour, a 30% reduction in missed appointments, overall reduction in wait times. Whether you look at enhanced disease management in Kenya, in HIV and ART uptake, whether you look at increased data quality in Nigeria and Rwanda, studies that have shown that data quality improved by 142% in Nigeria, and in Rwanda, EMRs resulted in 92% reduction in defined data errors. And then, of course, improved systems and research, linking interoperability from the clinic level to the national level. And so, we've shown, a wide range of results in ours. So we piloted, for example, in Malawi, HIV results times went from 6 days to 15 minutes. We have 45 clinics in Transmara district in Kenya. We have Ebola. We did an Ebola response when Ebola was in Liberia, individual tracking in DRC, as well as thousands of mothers and babies in Zanzibar receiving proper care. And tens of thousands monitored through labor and delivery in both Kenya and Zanzibar. So, overall, we've installed in 904 clinics, 400,000 patients, and less than 1% hardware failure since our version 6 came out 3 years ago. Now we're in version 7. Successful cloud data sync of over 99.5%. And some of the other accomplishments that you see here, I just touched on the previous slide. So happy to answer any questions. I know that was a lot of information, but really looking to develop partnerships, and thank you so much for giving me this platform to explain our solution.
Thank you so much, Sam, for your presentation. In case of any questions, feel free to tag Sam in the chat. So I'll hand over back to Benjamin to give us the next bit of what is going to happen.
Come out is why the EMR4All project. And this combined both what Grace and Sam have highlighted, and this is why we came out to present some case studies, especially for the experience of Vecna, that they have established offline solution to address those remote-less areas. So where this idea come from and where the team has reached out into going forward offline capable electronic medical record solution. So now on, there are different places which are disconnected, rural, mobile clinics, camps, and where you can have infrastructure server could not reach. Or if it reach, it takes you logistic to carry them, and maintaining it's not such easy. And this is how this project, this idea comes of how solution, what are the possible solutions to address this remote-less area. And that's what Sam presented, and showing that there's a possibility, there are solutions that exist which enable to power the remote areas where there's a problem, there are disconnected issues. At EMR4All as well, we have packed a similar solution which is built on Raspberry Pi, enabling to provide to deliver this same in the same approach of solving the issue of addressing the challenge that are related to remote-less area. So combining all those efforts, what are we going to look forward during this hackathon? We have two major objectives. The one first is to ensure that within the community that we have for OpenMRS, those who are part of the community must have a good understanding of how to operate with OpenMRS solution. For those who are interested as developers, they should know how to code. What will be what are requirements to provide support to the tickets? They are, as Grace mentioned, we are all working on the community basis. So OpenMRS is not the company that is selling a product, but is joining effort of many. Now we are more than 1,000 people bringing their skills to provide a solution working. And many of you have been there for long. Many of you are new as well. So how now do we combine those who are joined that entry to be able to provide, to deliver what is to understand the structure and also to provide. And this is why what is one of big objective for this hackathon. So we look at having the developer track for those who are experienced already. We gonna make sure that over these 5 days, you can come up with one of the tickets that is pending. There are a lot of tickets, but we'll pick one and let you go through until deliverable of that ticket. What are we going to add? What is the aim of that? So I'm going to explain quickly. So for the newbies, the new that I joined, so you are discovering, you want to learn, you want understanding, you want to jump into OpenMRS, but you don't know where to start, or you have an understanding and little bit hesitation. So throughout these 5 days, you have mentors, so we call peer reviewers, who will be helping you going through understanding questions and be able to navigate through, and up to the end of the day, the end of the week, you can say, yes, I've installed, I've produced, I've done this. This is actually the aim. Implementers as well. Please, Ben, or one of the presenter, if you are joining, just let us know so that we can shift the flow. So implementers, we are expecting for how to roll out OpenMRS. If I have a clinic and I want to implement OpenMRS in the project, where to start. This is where in this track we'll lead you from the start how to deploy OpenMRS. And we want to make sure that by the end of this hackathon, you are able to show that, yes, I installed OpenMRS on my device or whatever, the way how it will be structured. So then will be the goal of that outcome. So we have within that implementers also a track for EMR4All product, which is also for those who are interested to look at the offline capable solution, what is there, what is exist. So we have a team that has developed the product, which is packed in, where we have the OpenMRS and BAMNI rolling on the functioning on PI, and we have also like the synchronization module. Most of you know about it, and we have also the part of offline artificial intelligence. So these are also part of implementer. So it's part of the process, that track to lead people. So, but we need advocacy. Advocacy is a track which will go about, where do we get this system to roll? How do we need to work with MOH and project? How do we carry the message to those who had the power and those who are able to support the scale up of different solutions? It's not only EMR, it's also OpenMRS. It's also covering the topic of when it comes to go to remote place, there is need of resources. How do we go about fundraising for those clinics? Where do we get the equipment? If we said, yes, let's go to LightBox that Vecna has, it has a cost, it has an infrastructure. So where do we get this money to get this solution? If we go about the Raspberry Pi, is not for free, so it need to be paid somewhere. So this advocacy will come out to the strategy. How do we fundraise for this, as we are targeting non-profit approach, and how do there are different streams. There's a grant proposal, there are bidding and stuff. So this team will work on that, and it's how we structure splitting into those different groups. So to join in, but this is all about. So what are we going next, and what is next step for this? So you heard for different presenters, you heard from what is OpenMRS and how the community operates. So what would look to first of all, I think what would look is to see now how do we navigate all together as a team during this session to be able to deliver the different tasks. So this will be the next question, the next aspect for after this plenary kickoff. So may I check if there are some key questions which I saw there on the chat, which either Sam or Grace would wish to address.
I don't see any new questions, but I'll keep looking. And Sam, I had a question for you about, can you tell us a bit more about how Vecna is hoping that this week volunteers can help you from an OpenMRS perspective?
Sure, yeah, great question. For me personally, I'm in what Benjamin was just talking about in the advocacy track. We're trying to build coalitions and interest to get this into more governments and to more ecosystems. We have a pretty strong grant writing team, as well as a business development writing team. We also realize that a lot of these conversations are quite a long conversation. So, for example, in Ethiopia, it's been close to a year of conversations with the government to get them in at scale. That's long, right? And we, I think, have to advocate for putting in solutions that are quicker and more lean, and that can be used from disposable or pre-allocated funding. And the challenge for a lot of these governments, especially in the post-USAID world, as we've seen, is that there isn't quite a lot of funding. And I think it's on us as a community to make the case that actually, yes, it's an investment, but it saves money in the long run. You look at the slides that I gave on, a lot of these governments spend a lot of time reconciling data that they really shouldn't have to be reconciling, or not knowing how to deploy resources effectively because they don't know what's happening in rural areas. that's highly costly. You don't always see that cost on paper as a government official. And actually, to be maybe as background, I used to work in both the U.S. government as well as the Ethiopian government, embedded in these types of issues. And you don't always see those costs and can't always quantify them as a government official, but they're there. And so it's always challenging to make that advocacy case that money needs to be spent up front to save or impact later. When they're looking at how do we minimize costs. And so for me, it's around building partnerships, whether you look at an organization like the Gates Foundation, maybe the MasterCard Foundation, whether it be WHO as a multilateral, et cetera. There's lots of organizations that can come in and team up with the government. And I think buy-in really has to happen in both ways. One, buy-in at the government level saying, if we had funding, we'd love to do this. And then secondly, a donor or funder who says, yeah, we'd like to do this as well. What we don't see yet, unfortunately, and I think the day will come sooner rather than later, but what we don't see is clinics themselves having the purchasing decision to bring on these systems. And so, that's really top down from the government for a lot of these places. So, what I'm hoping is that we can build an effective coalition that really helps drive EMRs into more locations.
Yes, thanks a lot, Sam. Thanks for also coming on force on this initiative. So we look forward. I know you guys, you're busy, and but if you can bring up to based on experience, it will help this community for looking forward. So as we have this joint effort to scale up this solution, the big need we have is to address the people, to provide solution that whenever someone in the rural miles could also have medication, have better treatment, as that is our whole goal we have here. So any other quick question?
I think you have a couple of questions on chat.